July of 2015, Dr. Chandler and I left employment at Powell Valley Healthcare and started 307 Health. And our reason for starting 307 Health was we wanted to be able to create an environment where we could spend time with patients and where we could meet patients where they wanted to be met, and to be able to have healthcare, at least in the primary care setting, be a fixed, predictable cost. Along with the monthly membership fee, what you have is you have your doctor's contact number, and you can get a hold of your doctor basically 24 hours a day, 7 days a week, and you can choose how you want to contact us. You can contact us by calling us on the phone, by texting us, by email. We can do a lot of visits just through those mechanisms, but we also have obviously have an office so people can come and visit us just like you would at any other physician's office as well. The community has embraced this idea very well. I mean, we had a lot of people that were expecting that we'd be out of business before we even started, and then 2 years into it, we hired Dr. Bartholomew, and our practices are essentially almost full, all three of us, and so we're trying to figure out what the next steps would be for 307 Health and for direct primary care in Wyoming.
And what we do with direct primary care, by making that a set cost up front, a set income on our side, so we're not having to generate visits to generate income, but instead we want the patients to access us early on in the problem. Maybe that access is by email, or that access is by texting. And hey doc, I've had this cold for 3 days, what should I take? And with a simple text and maybe getting somebody pointed in the right direction, we've avoided a visit, we've avoided an after hours visit, we've maybe avoided a weekend ER visit, and hopefully we've avoided a lot of cost to the system.
So we've been working with some employers who pay the monthly membership fee for their employees and their families, and initially that was on a much smaller scale, but now we get some bigger employers who are working with us, offering direct primary care along with insurance and a higher deductible, to see how can the two being coupled really help save them in the long run on their insurance. And that's where we've been able to work with them with our own business, but also being part of a bigger conversation about how does this expand and spread throughout Wyoming with direct primary care and insurance conversations in general.